Hello, good morning everyone. I'm Dela Vega and I am your hospital training officer. I would like to welcome you all for this course, which is the Pediatric Basic Life Support. In this training, we are going to cover the step-by-step process of providing an effective and efficient basic life support for our pediatric patients through discussion and demonstration. So now let's start with our course objectives. The first one is to identify key components and the correct compression to ventilation ratio for pediatric BLS across different age groups. Second is to explain how pediatric BLS techniques vary by age, focusing on compression depth, hand placement, and ventilation methods. Third is to demonstrate proper pediatric BLS techniques, including hand placement, compression depth, and ventilation in simulated scenario. Fourth is to analyze a pediatric BLS scenario to select the appropriate intervention based on age and developmental age. Fifth is to assess and improve your pediatric BLS techniques based on feedback and self-reflection for optimal care. And lastly, is to apply appropriate pediatric BLS techniques in scenario-based assessment at the end of this course. Before we proceed to the step-by-step demonstration of pediatric basic life support, I want to give you some key points. First is regarding the use of electric pads. This is an adult pads. We can use this for a pediatric patient. But a pediatric pads, we cannot use it for adult patient. What is the main reason? I heard it right. The main reason is the pediatric pads is designed for a lower dose of energy. So it will be ineffective if we will use it for adult patient. Second, are the different terms that American Heart Association are using. Infant is defined as 0 to 1 year old. Children is from 1 year old to age of puberty. And puberty is defined by American Heart Association as, for female, there will be breast enlargement, and for boys, there will be voice deepening, and there will be hair growth in the different parts of their body. And then let us also differentiate some terms: heart attack and cardiac arrest. What is the main difference? Heart attack is due to blockage of the artery. So there is insufficient blood flow to the different parts of the body. Cardiac arrest is when the heart stops beating. This is due to electrical impulse, meaning there is abnormal rhythm in your heart. So this is the cause of the sudden collapse of another patient. But usually, for a pediatric patient, the main reason of arrest is due to respiratory. Yes, for pediatric patient, it is due to respiratory or lack of oxygen in their body. That's why pediatric patient will arrest. It is maybe due to obstruction, choking, drowning, or either asthma. So now let us proceed to the step-by-step process or demonstration of basic life support. First step is we need to make sure that the scene is safe. You need to give any help. Safety is always our priority. So scene is safe. And then next step, check for responsiveness. For infant, you need to tap the feet. Hey baby, are you okay? No response? Ask for help. Activate emergency response system and get the EED. or the automated external defibrillator if you are outside hospital setting. But if you are inside the hospital, they will bring the defibrillator together with the crash cart. So, when you will go back to the patient, check for pulse at the brachial area. For how long? At least 5 seconds, but not more than 10 seconds. So, you need to check simultaneously the pulse and the breathing. So, you will open the close. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No response, no breathing. So, we can now proceed to do CPR. If you are alone, you will use your 2 thumbs for doing CPR for an infant. What is the ratio? 30:2 if you are alone. But for 2 rescuers, you need to use the ratio of 15:2. 15 compressions with 2 ventilation. So this is how to do it. I am alone. Where you will put your thumb at the 1/3 of the sternum. How depth? It should be 1.5 inches or 4 centimeters. So now I will do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then after 30 compressions, you need to give 2 ventilation. In giving ventilation, you need to bear in mind that you need to seal the mouth of the baby and no air leak. 1, 2, and then again, you will continue to do CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2. And then help arrives. So now, you will change now your technique in giving CPR. Because you have your colleague now. So, your colleague will stay at this side and you will be staying here. So, you will do now your thumb encircling technique. It is like this. Your hand will be here, 1/3 or just below the sternum. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 15:2. And then your colleague will be the one to do the airway. 1, 2. While giving ventilation, you need to observe for the chest rise. If there is no chest rise, what you need to do? You need to reposition your ambo bag or the head of the baby. But you cannot use head tilt maneuver. You cannot use it because it is not intended for pediatric patient. It's only for adult patient. It is because it is related to the anatomy. When you will do the head tilt maneuver, it will clog the airway. The tongue will block the airway. So, I will do it one more time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then 1, 2. How many cycles? And then you will switch rows. Yes. Exactly. Every 2 minutes, you need to switch roles, meaning the airway will now become the compressor and you as the compressor will become now the airway. This is to avoid what? Avoid fatigue. Yes, correct. And then what else? One thing more, don't forget that in pediatrics, it is important that you need to keep in mind if it is witness or unwitnessed arrest. For witness arrest, you can go and ask for help first. But if you did not witness the baby collapse, you need to do 5 cycles of CPR first before you go and ask for help. You need to keep in mind that witness and unwitnessed arrest for children are different in adults. So in children, if you witness the arrest, you can ask and you can go and ask for help first. But if it is unwitnessed arrest, you need to do 1 cycle of CPR first before you go and ask for help. Before we end the sessions, do you have any questions, recommendations, or any clarifications? You are welcome to ask questions. If everything is clear, I would like to say thank you for your time and I wish you good luck to your stay in this hospital and to your nursing career. Bye!